Welcome to the Jacksonville Momcast, a podcast dedicated to telling the real stories of local Jacksonville moms. Sponsored by Jacksonville Beach Moms, each month we'll cover topics to help you navigate mom life on the First Coast. Thanks for joining us as we tackle all things motherhood and more with a focus on the 904.
Welcome to episode 35 of Jacksonville Momcast. Our guest today is Alice Beard. Alice is the founder of Premier Medical Spa. So Alice, tell us a little bit about yourself.
Well, thank you so much for having me. I am a physician assistant and I graduated from the University of Florida in 2002, which seems like a million years ago. And I chose to become a physician assistant because I didn't want to specialize in any particular area of medicine. At the time, I was a paramedic in high school and through college, and I thought I wanted to do emergency medicine my whole life, but I wasn't sure. So I didn't want to do a residency, so I chose to become a physician assistant, and I'm really glad I did because, shortly after starting my practice in medicine in emergency, I quickly switched over to dermatology, and that's what I've been doing for many, many years.
That's awesome. So tell us a little bit about Premier Medical Spa.
Premier Medical Spa is a business that I started in 2015. I never actually had aspirations of starting a business. I worked in general dermatology here in Jacksonville, and I had a very large patient following on my own within the practice. And I was the only practitioner within the very large practice that I was with, which actually doesn't exist anymore, but it was called North Florida Dermatology. And I was the only practitioner really that did any aesthetics in the practice. And so as North Florida Dermatology was sort of phasing out, I was doing more and more aesthetics and along with general adult and pediatric dermatology. And my patients were very supportive and sort of adamant about me considering doing something on my own. And so it just kind of gradually formed itself and just started small and it gradually grew. And thanks to my patient support and referrals and things like that, it is what it is today.
I love that. I love that the patients kind of pushed you to take that next step.
I never intended to do it myself, but the goal was to be able to provide services that most medical dermatology insurances will not pay for. Unfortunately, in dermatology, a lot of the stuff just isn't paid. They want to throw, pharmaceutical drugs at a lot of things that with skin is just not necessarily the answer. Sometimes we need to get down and clean the skin out, or we need to apply things to the skin. Sometimes repetitively, a perfect example that's super, super common is like warts, common warts that kids get and adults get and things like that. That's something that has to be cleaned off and treated multiple times, as many people know. And just general dermatology insurance isn't going to pay for that over and over and over again the way that it can be successfully treated. And so that's kind of was my aim, was to open up a door to where people could come in and get treated at reasonable prices where their insurance wasn't going to pay. Like with acne, chemical peels and facials and cleaning out the pores and things like that helps. But all we're really offering in general dermatology is prescription medication, and we really need more than that. And so that's kind of what I wanted to do with the spa.
I love it. So you mentioned one of your titles, or your title is an aesthetic specialist. Talk to us a little bit about specifically what that is and what you do.
Well, aesthetic specialist, I think, combined two important things. One is more of an artistic eye. So when you're, someone's trying to maybe get back to how they looked 10 years ago, 20 years ago, or rejuvenate where their face is now to look a little bit more youthful, but still stay natural. We just have to sort of blend away some of the shadows and maybe put some highlighted areas in certain areas just to give them more of a youthful look, but still keep them very natural. We don't want to give people these pillow faces and overfilled lips and angled up eyes and all the things that we're seeing that we just really don't like and catches our eyes as we're walking down the street. That's not what we're aiming for. We're aiming to keep people looking like themselves, but more refreshed, more confident, and feeling like they feel on the inside most of the time, or would like to feel on the inside. So you really have to have an artistic eye for that. You just can't have a cookie cutter magazine idea of what you're going to do to every single person and just make everybody look the same. And so I think with an aesthetic eye, you have to have some sort of artistic eye to take to every single face. So that's one. And then two is specialized training in regards to anatomy, in regards to how the different types of techniques we can use and where we can place these different techniques and fillers and toxins and threads and all the different things that we do use in a safe way, because there's so much going on by just anybody anywhere that is not safe, as we see in the media. And that takes a lot of specialized training and staying up to date, because aesthetics changes every single day. And so for us to be able to stay on trend, quote unquote, and stay safe, we have to keep training endlessly. And I think people don't necessarily realize how much training goes into that, and going to conferences and keeping up with all the other physicians around us and things like that.
So true. And we're going to talk a little later about those questions to ask before you seek treatment. Mm-hmm. So I think a lot of people hear the word aesthetics or medical cosmetics and they immediately think Botox. Mm-hmm. I mean, that's true for me when I first started, kind of researching what you do. And you mentioned the chemical peels, you mentioned, things like wart treatments, but tell us a little bit about some of all the different types of services you offer, because I know that it's a wide variety after kind of delving into it. But I think that someone who isn't familiar with the industry immediately thinks like, oh, she just does Botox. So talk to us about, some of the other stuff.
Well, it's an endless list, really, that we can do, especially having a dermatology background and an emergency background. But really, in general, anything that is concerning you or causing you issue, skin, hair, nails wise, we can address it. So anything from skin tags to acne, any type of rashes or lesions that you have, we definitely can take a look at. And if we can't do it here, I like to keep a very close-knit referral base. So I do keep a close on who I think the best of the best is in our area. And of course, that's just my opinion. And I always recommend people get multiple consultations. But I do like to keep a very close-knit referral base of who I think are great eye doctors, facial plastic surgeons, ocular plastic surgeons, that type of thing. So if we can't address your concern, I'm going to quickly send you to who I think can address your concern. So, your consult is never wasted here. But we do peels, we do facials to get the pores cleaned out. We do some liposuction, small volume. We do some regenerative medicine where we use your fat cells and we can take those and use the growth factors and stem cells and things like that that are associated with fat cells to be placed back to rejuvenate the skin naturally. We have machines now that can stimulate the muscles to give you a more defined muscles that can destroy fat non-invasively and tighten the skin non-invasively. We have machines that can get rid of sun damage and blood vessels. We can regenerate hair growth. We do that a lot with platelet-rich plasma and platelet-rich fibrin. So the list just kind of goes on and on. We can remove lesions and put sutures in to close them if you have a mole or a benign bump or something like that. Or we can do biopsies if we're not sure if something is cancerous or non-cancerous. So the list just kind of goes on and on. I get asked about different things all the time. They may be here for their Botox or their filler, but we'll do a skin check for free just because they're here and we live in Florida and everybody needs to have one.
Absolutely. And if anybody listening has not had a skin check, I highly recommend that you find a dermatologist. Or it's so great that you offer that because there's so many people that don't get them regularly. So one of the reasons a lot of people like services like what you offer is because most of them are non-surgical. And you mentioned kind of the liposuction and some of the more invasive, but a lot of these are a more temporary solution and a lot quicker and easier on the body, less recovery time. So what makes those such a popular option for people?
I definitely think that when you start earlier in life and you do small things like little maintenance procedures and things like that, you can really avoid some of these really large procedures, especially if you are taking care of avoiding too much radiation by wearing your SPF and things like that, which we address at every single appointment. I mean, we apply SPF to our patients before they leave the office. We readdress it every time they're here. We always have affordable options for people to purchase here. We have different options from powders to lotions to whatever pills. We even have SPF oral vitamins you can take that block the sun's rays if you don't want to put anything on your skin. So there's just so many different options that we have available, and we go over with everybody and we stay up to date on all that stuff. So regardless of why you're here for your free skin check or for your Botox or your any other type of toxins, we go over it all with you. So, but certainly the earlier you start, I think, especially by doing a lot of the stuff that we have in regenerative medicine, like microneedling and Morpheus and platelet-rich plasma, you're using your own body's immune system to heal itself. You can avoid a lot of the long-term stuff. As well as, of course, eating healthy, keeping a healthy body weight, exercising, those types of things, which we encourage. But yeah, a lot of the less invasive procedures are nice because maybe they're not permanent, but they do last a long time. And while they're in there, especially like filler, they're stimulating collagen, elastin in the right place. So they might not last forever, but they do a great job while they're in there. And we do now have permanent fillers, and we do have a long-lasting toxin like Daxify, which will last six months or more. And we have some, like, for example, we do a neck lift here called My Elevate, which is a suspension suture, which is permanent, that goes from ear to ear, but there's no sutures. So there's really little to no downtime, but you are getting a very tight neckline. And so that is a permanent procedure. So we do a lot of less invasive or low invasive procedures, and it doesn't take people away from work as much as a surgical procedure does. Now, not everybody's a candidate, and if you're not a good candidate, I'm going to refer you to a surgeon, or at least recommend you get an opinion from a surgeon. But I think that there's definitely a benefit to not being exposed to general anesthesia and not having all that time off if you can avoid it.
Yeah, I totally agree. And as a mom, I always think about like, what's my downtime in terms of, you know, driving kids around and just busy mom life. So you mentioned starting early and seeing someone like you and that does medical aesthetics. How early? Like, what age do you recommend people start getting a referral, you know, or just coming by to kind of see what you have to offer? And then along with that, how often should people come and see you?
Well, I mean, we've got people starting in their teens and 20s, and I don't think that's a bad thing. I mean, if I had known, I would have started that early too, just because the more you know, it's like if somebody had sat me down and said, "Hey, this is available," I mean, I would have loved to have known that. So I think just that doesn't mean you're going to do anything, but at least you know what exists out there. So I would start as soon as I knew, you know, I would just get a consult and know what my options were. And kind of one of the things I show people is kind of just genetically, this is the direction you're heading in, you know, or what's bothering you now, or what bothers you in the parent that you look the most alike, type of thing. And I can say, okay, well, that's, you know, this is how you're going to progress in the next 10 or 20 years. And so if you want to take slow steps to avoid that, this is some of the slow steps we can take. So that's that. So, you know, as early as you can, I guess I would say, in regards to just like in your early 20s, I would say, just to kind of get a baseline idea of what you can expect if it's something that you're concerned about, and definitely to get educated on just basic skincare for yourself, even if you're just using over-the-counter products, and certainly sun protection. But how often? I would say every 3 months to every 6 months, because things like microneedling, like I talked about, which is a very inexpensive treatment with almost no downtime, is allowing the body to stimulate itself in healing and rejuvenation. And that's something that you can do quarterly, or a facial that you could do quarterly. And it's going to help to stimulate the body to, again, produce more elastin, collagen, repair, that type of thing. And you're still staying in contact with your, you know, our office, which is dermatology and medical aesthetic and that type of thing. So if you have any other questions, or maybe you bought a new product and you want to ask about it, that gives you that opportunity as well. So I think quarterly is a good idea, or every 6 months if you don't have that type of time.
Great answer. For those who don't know, tell everybody what microneedling is.
So microneedling, or collagen induction therapy, I feel like is a kind of a staple in medical aesthetics. It's a little pen that's got like 10 to 20 tiny little needles on the end of it. Each needle is about the size of a hair, and we numb your skin, whichever area we're going to treat. So you don't really feel much from it, but a vibration. And the little needles go up and down like a sewing machine, and they create hundreds of thousands of tiny little punctures that you cannot see, in a very clean environment. We do for example, your face, we do your eyelids, we do your nose, everywhere, your lips, everything like that. And those little punctures make your body think that there's been an injury to the area. And so the body then stimulates the immune system to go up and heal that area. And all the little growth factors of your immune system, which we use to heal anything, a burn, a broken bone, any of those types of things, are going to rush to that area to try and heal it. And when it gets there, it realizes, you know, that you don't have a bone or a broken bone, and instead it's going to take care of sun damage, discoloration. If you've lost any hair, it's going to grow the hair back. Any scarring, acne scars that you have, any active acne that you have, any of those types of things, it's going to fix for you, because that's what your immune system is made to do. And so it will continue to do that for several months. So when we do that treatment, we like to see you back at about 4 to 6 weeks, so we can take an after picture and show you what your immune system's been doing for you for the last 6 weeks, because it's been happening so slowly, you probably haven't noticed much. And when we show people those pictures, they're really impressed at what their body has done for them. And we airdrop them to you so you can take them home and that type of thing. And you'll continue to see improvement like that for about 3 months, which is, you know, that quarter is now up, and you should come back and get either another one, or maybe do another area like your neck or your chest or any other area that you might be concerned with. And the downtime on that is typically overnight. Those little tiny holes will close up overnight, so you can go back to wearing your makeup and your sunscreen and go back to work and everything like that overnight.
Wow, that's amazing. I had never heard of that. So thank you for explaining it.
Yeah.
You mentioned that this is an industry which is constantly evolving, new products coming out, new services coming out. What have you seen in the last 3 to 6 months that's new on the market? And then do you have any predictions about what the future of aesthetics looks like?
Well, one of the newest things I think that just did get released was the Daxxify that we talked about. So Daxxify is the latest toxin, and it does last 6 months. So that's we've right now got Botox, Xeomin, Dysport, and Jeuveau are the toxins that are on the US market. And so Daxxify was just released, and it's the first one that's going to last 6 months. It's also not attached to a human protein, it's attached to a peptide. So it's also different in that way. And it's also the first toxin to be completely made and distributed in the United States. So that was a pretty exciting launch, and we just started using it in our clinic over the last couple of months. And so that's a brand new thing, and I think it's very exciting, and I'm excited to see where that goes. So that's been fun. There's always new fillers rolling out, but there's just little nuance changes in that. So nothing really too amazing there. There's been a new RF device that came out that does some what we call micro coring, but we're still kind of waiting to see what's going to happen with that. Always new machines coming out. There's a lot of stuff going on, I feel like, in vaginal rejuvenation and female rejuvenation. So I think a lot of the tech departments are paying a lot of attention to women's needs in regards to non-invasive female rejuvenation, especially, post childbirth and things like that. So I think that's exciting for women. So I think that's a lot that's been happening. I've been seeing recently hitting us. And then coming up, I think that people are going to continue to find ways to have improvements non-invasively. So anything we can do to continue to tighten the skin and lift the skin without downtime is going to continue to flourish, because the world is so busy, nobody wants to take the time for that. And when you do put in general anesthesia, the risks just go up. And so people, physicians and patients, I think, are both always very careful when it comes to that. There's always going to be a space for it. We have to have it. But as long as we can avoid it, or we can do things in the office, then I think that industry is going to continue to grow.
I would absolutely agree. And I think also, you mentioned earlier about, seeing some bad work getting done, or people not filling correctly, or using products too much or too little. And I think, especially for people just starting out with aesthetics, like you can be nervous that, are you going to look different? And so to have those options that essentially will start to wear off, after 3 to 6 months or a year, it kind of gives you like time to think about, like, is that really what you like? Is you want to do something a little different next time? And it's just so nice to have that less permanent option. So I feel like the younger generation, which I am not a part of, but we'll talk about it.
Me neither.
I feel like there's so much less of a stigma for them when it comes to aesthetics and medical cosmetics. Do you see a difference in, like you mentioned, the early 20-year-olds coming to see you versus people like our parents' age that are coming in? What do you see as far as that?
To be honest, I don't have like my pulse on the high school, college age kids, but I do see some from time to time. And what I have personally seen, at least in our region, is not as crazy as we see like on the social medias, which is a relief to me. So that makes me happy. The things that they're coming to fix, or at least that their parents are letting them come in to fix, are little things that I think are very reasonable. If they weren't, I wouldn't be doing it, to be honest with you. But there are little like bumps on the nose that from a profile are certainly I would be, conscious about too if I was a younger person, or just little things like that where it's a tiny little tweak that I'm making. It's not permanent. It's saving them from maybe having a surgery that would have been permanent. So I'm actually quite happy to do little things like that for them. It really changes their self-esteem. It builds them up. It makes them feel so much better. And when I think back to when I was in high school and I was self-conscious about X, Y, or Z, it would have been so nice if I could have had that little tweak at the time to make me feel more confident and not have to think about, oh, everybody's staring at this or everybody's staring at that. So I'm happy to do it if their parents are on board. Even the college kids are coming in with their parents. So I'm happy to do it. There are some that are, a little overboard, and I am maybe different from a lot of other clinics in that I will tell you that you're a little overboard. And I'll just say, like, if you do this, it's going to look a little unnatural. And I need you to know that if I do it, people are going to stop and they're going to look at you from an unnatural standpoint. And before I do anything like that, and if it's too extreme, I just won't do it. And if it's unsafe, I absolutely will not do it. So, but I'm glad to see that at least in our region, I'm not seeing a lot of crazy, unextreme stuff at all.
Well, that's good. And I think that being a mom and having your own kids and kind of seeing how, like you said, social media influences stuff. And so I think that gives you a unique perspective in that, world. So I feel like, and maybe this is because I'm not in the industry, but I feel like there's been a lot of medical spa businesses popping up in the last, I'm going to say like 3 to 5 years.
It's overwhelming. Yeah. Mm-hmm.
Okay, so it's not just me. So that's good to know. How can people make sure they're being treated by someone who is an expert and someone who, really knows what they're doing? And like you said, is going to kind of watch out for their health and their overall wellness in addition to, providing them with their aesthetic services?
Yeah, that's a tough question. I guess I would look at how long they've been doing it, because aesthetics is all about experience. You've had to have done X amount of cases in order to have seen X amount of problems, because you drive a car long enough and you're going to get a flat tire. You drive a car long enough and you're going to have so many problems. So it doesn't matter how great of a driver you are, something is going to happen. And that's just the name of the game in medicine too. You can be the best of the best and be so well trained, but the real test is when a problem arises, how do you know how to handle it? And can you rise above the stress of the whole thing and make sure it goes okay? And so I think that that's the real key. And I think that only comes with experience. So of course, and training, of course. But I mean, you could attend 1,000 training courses, and unless you actually encounter the problem and fix it, then you still don't really know 100% that you know what you're doing. So for me, if I was going to find somebody, I would want to find somebody that has years of experience of doing something. So I think I would look at their experience. How long have they actually been doing the work that they say they've been doing? Of course, you want to see their pictures, but people only really post the pictures that they think are the best. And I don't actually know how to alter a picture, but people do know how to alter pictures. So you have to be careful about that. So I'd look at experience. I'd look at training. You can go through people's Instagrams and Facebooks and websites and see what trainings they attend and what other physicians they associate with, and those types of things, to make sure that they're going to the correct trainings and what schools they've gone to for their initial schooling and that type of thing. And then, of course, referral is always nice. If your friend's gone and had a good experience, then than that. And then this is one other thing, when my patients move away and they always ask me, do you know such and such over here? And I'm like, no. I always tell them, get something small done. If you're not sure, go in and get something small done. Instead of going and getting all your Botox done, go and get one area done. And if you have a good experience at the office and you have a good experience with the provider and that one area turns out good, then you probably can feel more confident going back again and getting something else done. So that's another way I kind of test the waters.
That's a great suggestion to get something small, especially in an industry where you could do just a tiny something, or you can do, quite an extensive regimen.
Yes.
So, and when they go and they have, something done, what types of questions should you ask at your first appointment to make sure that your provider is a good fit for you?
Yeah, so again, that same type of thing where you're going to see the person the first time, I would just, see how the office rolls. Do they get those before and after pictures? Do they go over your consents with you and make sure that you're getting consented and HIPAA and all that stuff that you're supposed to get? When the provider comes in, how do they introduce themselves? Do they go over your medical history? Do they ask you what's bothering you or what you'd like to get done? See what they suggest and how they suggest it, see how you feel. I mean, I really am a believer in sort of like energy and vibes and that type of thing. So if you feel like you're vibing well with that person, then go over the one thing you want to get done that day and have them go over it with you and see if they talk to you about other things like protecting your skin and other things that go along with why you're there, and see if they have an educated talk with you, that type of thing. And then let them do that one area and see how the post-care experience goes and the checkout goes. And if it all goes well, then I think, see if you ask to see before and after pictures, like, well, I'm not going to get filler today, but maybe on another day, or I'm not going to get microneedling today, but maybe on another day. Do you have any pictures I can see? Then you could look at some of their before and after work at that time, that type of thing, and just kind of get to know them a little bit better. And, that's kind of how I would go about it. And then decide if you want to go back and get more stuff done.
Excellent. Good list of questions to ask. So let's switch gears a little and talk about pediatric dermatology, because you spent many years in that area, and I know you still now occasionally see, teens. What are some things you wish parents all knew about their kids' skin?
Oh, that it's like brand new baby, baby skin. And I just wish you'd protect it from the second it like hit the world. Like my favorite maternity gift to give is sunblock. I give out this like powdered zinc that I give, that of course, you can't really put around their nose or anything, but you can put on the rest of their body, and it's safe. Just really, really protecting their skin. I think parents are really doing a great job at it now, though, because there's UPF clothing that you can get just anywhere, a Walmart, Target, anywhere. And so parents are doing a great, great job really protecting their kids with UPF clothing. But I taught my kids from the moment they started brushing their teeth to put on their sunblock. So they've been wearing sunblock since they got a tooth. But I'm the crazy skin person. But I mean, if you can sort of start instilling the fact that, you got to brush your teeth in the morning and put your sunblock on, especially here in Florida, it's just and put your seatbelt on. These are just natural things that you do, like a reflex. Then it's a good thing. So, just knowing that it's their skin. I think another thing is parents are so scared about, their kids scarring, their sweet little babies scarring and stuff like that, because they fall on their face all the time and they fall in the driveway. And, babies, kids' skin, their cells turn over so quickly. So, I would say don't panic so much about that, because their skin cells are going to turn over so quickly. And yeah, I see a lot of young kids, 5-year-olds even, that I'm seeing with these little scars and stuff like that. And certainly you're welcome to come in and we'll talk about different ways to help mend them and things like that. I'm happy to do all of those things, but they're going to heal up pretty well because they're just so young that those skin cells are going to be exfoliating and healing up pretty well. So I would say that, and keep an eye as they're developing their moles and things like that they're all looking pretty normal, because that's going to happen through their teenage years. And you can always get a little skin check for that as well.
Yes, and my kids also are big on sunscreen and rash guards, and
that's so good. Mm-hmm.
We were just talking about that the other day, that our kids don't know anything other than like going to the beach with a rash guard, and they're teenagers.
My 15-year-old was like, I have to have my shirt on. I'm like, you don't have to, actually. You're a boy and you don't have to have it on, but they don't know any different.
Yep, they absolutely. And so how that's so different than when we were growing up, and how, I remember
naked on the beach.
Well, and I taught swimming lessons for years and years and years in South Florida, and we would special order a rash guard from this one place that carried them so that I could have it. But now it's like they're everywhere. They're in Target and Walmart, and I mean, they're at CVS. You can get a rash guard. So it's just so nice to see that just that one item becoming so mainstream for all ages. You can get them in 3-month-old little tiny itty bitty rash guards.
Yeah, it's a real shift.
Yes, it's just so great. And it'll be interesting to see as this next generation gets older, if there is a decrease in, sun damage and, sun cancers and stuff like that.
Great. You should go to a dermatology conference and see those kids. They're in like a full head to toe, like seal suit. It's funny.
I can only imagine how people who are experts in that field dress their children. All right. Well, is there anything else you'd like to add before we wrap it up for today?
I just really appreciate you having me on, and I definitely want to encourage everybody to wear their zinc, their mineral sunblock. I hope that everybody that tunes in is doing that. And I would definitely say, don't be scared of the aesthetic world. We're not here to make you look crazy. We're just here to help you feel good.
That's excellent. I like that. What is your favorite sunblock for your kids?
Zinc. I always make sure that there's zinc or titanium in there. I think over the counter, like Neutrogena sensitive skin has a good one. We sell here at the spa from the over the counter brands Vanacream. Vanacream is available over the counter. We carry their products, so we always have a really good affordable brand here for people to get that's hypoallergenic. So they have a really great sunblock. And then the powder that I really, really love is Color Science. Color Science has got a tinted powder that's an SPF 50. And I put that on my kids before they go to camp, and they'll swim all day and sweat all day. And I still have to loofah that off of them at night. It's crazy. Yeah.
Wow. That's awesome.
I put it on before their soccer games, and I have to loofah it off myself when I come home from the soccer game. So that stuff has never failed me. It's a little bit more expensive, but for me, it's 100% worth it. It's super portable as well. So I keep it in like the size of my car door, and I can reapply it before I get out. And it works instantly because it's a sunblock, not a sunscreen.
That's awesome. I'll have to check that out. All right. So I ask everyone, what is your favorite thing about being a mom in Jacksonville?
Oh, okay. Well, my kids are really heavy into soccer. And so I love our soccer community, I have to say. My boys played for Florida Elite, and they've been playing for them since they were like 3 years old, 2 or 3 years old. And now they're just doing so well, and we travel with them, and it consumes all of my time. So I don't see much else of Jacksonville besides the soccer fields. But I love our soccer community. We have so much fun playing with them and traveling with them. But I've lived all over the United States as an Army Army brat, and we chose to settle in Jacksonville. And I love living here. I love that it's a small, big city, and just how close knit it is. And I love owning a business here. So, as a mom here, I've really enjoyed being part of the soccer community with my boys. So we're going to keep doing that.
That's a great answer. And tell everybody where they can find you.
Oh, they can find me at Premier Medical Spa, which is off of South Point, which is at like JTB Butler and I-95.
Awesome. Well, we will put links to the website for the medical spa as well as your social medias in our show notes. Thank you so much, Alice, founder of Premier Medical Spa, and thank you for listening.
Thanks for tuning in. If you've enjoyed this episode of Jacksonville Momcast, be sure to subscribe wherever you get your podcasts and follow us at Jacksonville Momcast on all the social medias for show updates and more information about our guests. To learn more about what you heard today, visit our show notes at jacksonvillemomcast.com. Thanks for listening.